Hello, and welcome to another lecture from Jekyll's Epidemiology, Biostatistics, Preventive Medicine, and Public Health. This is chapter 26 titled Public Health Practice. And so far, out of the two lectures from this section, and there are a total of 6 or 7 chapters and lectures within this public health lecture. For professionals, this might be one of the more important lectures with respect to implementing public health programs and services, understanding what some of the community needs are, and trying to implement needed programs for communities and individuals that, for example, lack healthcare and other public health issues for that matter. There are many toolkits or algorithms and models and frameworks that help in terms of how are you going to assess the community's health needs, and then kind of downstream from that would be asking the question, and how are you going to implement it, and how are you going to evaluate it? Well, the CDC, this acronym change, stands for Community Health Assessment and Group Evaluation. So you can see the main points here are defining agenda, values, priorities with community stakeholders. And once you have that done, you formulate a gap analysis or a needs assessment. What is it exactly that the community lacks in terms of providing healthcare to its population? And then from there, you would generate objectives and interventions, whether they be services, programs, and products. And then one of the important aspects of an implementation of programs and services includes this multi-level approach. And that this means that it's not just an institution that is going to provide services, but it takes also a partnership of businesses within the community, advocacy groups, consumer groups. So all the players need to be able to play basically nice in the sand, so to say. In addition, it's important to understand that legislative, judicial, cultural, economic, and political forces are at play when trying to implement programs and services for public health. And then finally, evaluation. So how do you do community planning? In this particular slide, we're just particularly interested in how are you going to design the program, how are you going to implement it, and what are some of the evaluation methods and tools you're going to utilize. And with anything, there's always going to be a strategy that would evoke a response from the community that will help guide the entire planning process. And one of the techniques that's used is it's called the Delphi technique, and it's one way to not only develop consensus about what's needed with the particular program or service, but it's also to bring that team aspect or collaborate, or a very collaborative nature in decision making. And then obviously this is related to health, so you would identify, you need to identify the health issues of your community, whether it has something to do with the environment or obviously with pharmacy, a focus on chronic diseases, for example. So you're doing these gap assessments or needs analysis, as we've mentioned in the past. And there are these tools such as asset mapping, these acronyms, a lot of acronyms. And the book has a table that states what all these acronyms are. In addition to this, in the very end of this lecture, there's also that table that would showcase what some of these acronyms are. So PATCH, for example, stands for Planned Approach to Community Health. MAP stands for Mobility for Action Through Planning and Participation. And then there's this other very long acronym, Precede, Proceed, which will look at how this algorithm and this process, this model, and how it works. From there, again, we're going to fine-tune and develop measurable processes and outcome objectives to assess progress for obvious reasons. And we might look at particular national objectives like Healthy People 2020 to help guide us in terms of, well, what is it that's important in our community? What is it that's important, that's an emerging threat? Well, Healthy People 2020 helps to guide us in terms of some of the most crucial and emerging threats that need to be addressed. Again, MAPIT is another acronym that allows us to help develop the processes. And the United States Public Health Services Task Force also has a guide, which we'll touch on briefly in the following slides. So from here, you're able to select effective interventions to help achieve these objectives. You're obviously going to have to implement the selected interventions. And then finally, again, evaluation is crucial to any determination of program success. Okay, just stepping back a bit, and I think it's important to give another perspective here of some of the tools that's needed when developing community programs and implementing public health practice. And if you've had social behavioral pharmacy, which most of you had, I think the next couple of slides will hopefully jog your memory in terms of understanding and implementing theories, behavioral, cognitive, psychological theories that serve as frameworks not only to identify problems, but also to implement the programs and services with in an evidence-based theory-minded interventions. So understanding that the individual change is through kind of this community change. We call this the socio-ecological model, where at the center we have the individual, and then interpersonal, organizational, community, and then finally public policy. So again, this kind of relates to kind of this multi-level approach in implementing successful programs and services. Similarly, when we talk about changing behaviors in individuals, it also comes from this multi-level attack of making policy, of organizing community to change social norms, to induce organizations to change as well. So you have this social marketing strategy. And then interpersonal, meaning that it's the community, it's your neighbors, it's your friends, it's your family, it's your peers that's going to be very supportive in the goals set forth for achieving optimal health. So these are just some key words when you're writing up a proposal to conduct community change, to engage stakeholders. You want to understand these terms like empowerment, community capacity, critical consciousness, and social capital. So I think we all know what empowerment pretty much is intended to do, and that's to improve the community's confidence, improve the will of the individual, Community capacity is kind of this ability and the ability of the community to mobilize and identify and solve problems. Does the community have that? Okay, so that's the question that you're asking to address if community capacity is strong or if it's not. And obviously it requires leadership, participation, skills, and a sense of community. Critical consciousness would be the mental state of the community. This is kind of related to empowerment. Has the community recognized the need for social change? So if yes, you do have that critical consciousness. And then finally, do you have the resources? Do you have the networks that have communicated well, that are willing to work together, that are going to collaborate? Do you have trust? Do you have reciprocity? Do you have civic engagement? So if yes, these are all factors that are giving you the will, so to say, in terms of moving your program or service and community project forward. So once you have all that, sometimes you need to increase communication and you need to promote a community issue. So this is kind of the idea of how do you influence policymakers and encourage social change? Well, here this table kind of shows that there are 3 areas for promoting yourself, promoting others, or promoting the community. So that's kind of related to social marketing, public relations, and media advocacy, respectively. And you can see what would be the message within each section. You can see the target audience, and then the effect or outcome, and then the benefits. So for most community public health planning, it should go through some kind of media advocacy that is very strong on grassroots campaigning and development. So the message that they're trying to set forth is, look at us, here's our agenda, here are the issues at hand, and here are the policies that we think is needed or needs to be changed. And then finally, the target audience. Well, who are the stakeholders? Who are the policymakers? Of course, you have the outcome or the effect that you want from a social perspective, and then the benefits to the community through the policy. And then, well, what are some of the ways to disseminate a successful community strategy? Well, we take a little bit of this, we take some business and marketing theories to help us diffuse some of the innovations that we have in healthcare. So similar to Apple marketing their products, we're going to do the same thing in terms of marketing our social and public health programs. And there are 4 characteristics. What is the innovation? What's the product and service that you're trying to implement? What are the communication channels? So how are you going to get the word out? Who is involved, or what groups of individuals are going to adopt this? So the social system. And then the time. It's going to take time. In relation to time, there are certain groups who are going to be more receptive to your innovation, your service, or your product. And we call these groups, as kind of noted on the on this diffusion of innovation graph, you have innovators, early adopters, early majority, late majority, and laggards. So this is where we know that a majority of the people will wait for the program to occur, wait for that product to come out in several iterations before they purchase that new iPhone or that MacBook or that iWatch. However, we know that there are innovators who tend to take up the product right as it's delivered. And we call these innovators or early adopters. And then those who kind of fall at the very tail end where they just kind of wait till the very last minute, we call them the laggards. So how do we know if our marketing is working? How do we know if our diffusion of innovation is being taken by the community? So adoption depends on perceived features of the innovation or program or service. So is there a real advantage? Is it better than the idea before it? Is it compatible? Is it consistent with our community values, individual values? Is it consistent with the current process? Our past experience, my past experience, current needs? Is it easy to implement? Is it low in complexity? That's important. And then, could we give it a try? Is it something that if we is there a cost? Is there a high cost? Is it if it's very low cost or no cost at all, then you know that trialability is going to be fairly easy. And then, can we see it? Can we touch it? So if you're able to address all these variables, you know that you're on your way for a success in terms of the community and the population being wanting that product. And then quickly, just a couple more rules when developing programs or services that are innovative. Make sure that it's sound, that it's supported, that that you can capture those innovators or early adopters. And then those who are adopting it, make sure that you do give them some of their airtime or their media time, so to say, and so that others can see how successful they are. And then you have to be able to trust and enable if there is a reinvention or some tweaks that might be needed, that's kind of an exit strategy, if you will. And then so associated with that, yeah, make sure that you do have an opportunity to change. And then finally, if you're going to be developing this next great product or service, you should also be kind of at the very front of that movement, that you can also be the face of that product or service. Yeah, speaking of being the face of that product or service, the area of marketing is going to be very important for successful implementation of products or services. And so all these aspects of social marketing, from understanding your audience or your community, tailoring a specific message, maybe that it's very culturally sensitive, is very important in the success. If you remember in business and the marketing mix, so the 4 Ps, which include optimizing the product, the price, the place, and the promotion, this shouldn't be overlooked or underlooked, because this marketing mix will also determine if those early adopters are going to be very happy with your product or service. And then finally, branding, right? So I mentioned Apple. We all know the success of Apple with their very sleek and very aesthetically pleasing and very easy to use products. So understanding that once you have a successful brand, that will be a perpetual energy for success in the future. These are other important concepts in communication. We've mentioned a few already, but understanding that there are these concepts, communication concepts, in terms of media agenda setting, How are you going to work with the public? How are you going to work with legislators if you're going to do some policy making? Probably the most important is, do you have your problem defined? Having a very clear problem or issue is very important when communicating your product or service. And then finally, framing. So how are you going to deliver your message? What are you going to emphasize first, and what are you not going to emphasize so much? How are you going to package your whole communication? Is kind of related to marketing and branding again, right? How are you going to be seen by the public? So all these communication theories are very important again in healthcare, health policy, and public health. So one thing that has evolved over time is the way that we've communicated and the media that we use, from the new media now of smartphones, Wi-Fi, accessible Wi-Fi for free and almost available internet anywhere you go. This is a new period in our history where we have real-time communication with individuals, communities, and the world. So what are some of the major benefits of this new media? And of course, we all know that even at every institution and every industry, whether it's, I mentioned Apple, and the way that they communicate their messages with their very cool and sleek commercials, healthcare institutions are doing the same, right? So why? Because there are these benefits with utilizing this new media of real-time access to information. You have increased reach. Your communication can be done almost anytime and it's boundless. You have quite a bit of integration with other communication modes. And this is an important one for research, which is tracking, right? We can see if our message is being heard and what are the potential outcomes and what are the potential barriers and what next. It's a form of evaluation when used appropriately. There is a lot of, normally when used appropriately, there's a lot of control. And then finally, there is quite a bit of interactivity when utilizing our new media, right? It's from Facebook to Twitter to Pinterest to LinkedIn to the news media. Somehow the integration and the interactivity is quite amazing for information technology these days, and it can only benefit health and public health. This was mentioned earlier, so one of the planning models or frameworks, so the precede, proceed, you can see what precede stands for. Predisposing, reinforcing, enabling, constructs in educational diagnosis and evaluation. So precede is kind of the first step. So if you look at the model here, it's steps 1 through 5. You are, for the most part, doing a gap analysis, a needs assessment. You're doing diagnosis. So you're looking at social assessment, epidemiological assessment, behavioral environmental, what is the educational and ecological assessment, and then what are the administration and policy diagnosis that needs to be utilized so that you can implement your new program or service. So once that assessment is done, you can proceed. So proceed stands for policy, regulatory, and organizational constructs in educational and environmental development. So as that name implies, this is where you would implement. You would implement your program or service, and by process evaluations and other evaluations, and in behavioral and lifestyle changes, environment, health, and quality of life, for example. Another way to conduct the needs assessment as well as implementing your program or service is through this MAP. MAP stands for Mobilizing for Action Through Planning and Partnership. This is a framework developed by the National Association for County and City Health Officials, along with the CDC. And there are similarities. If you look at the model, and in the core is much like a short version of precede, proceed, right? You have a strategy, do the assessment, implement, and then evaluate, plan, and implement again. So that's the action. That's kind of the very bottom part. But what's nice about this framework is that it shows kind of the foundations that's needed when organizing community and public health activities. And what's needed? Well, you need a certain understanding of the community. So community themes and strengths assessments. You have to understand, well, what are your resources with local public health systems, right? And then they're kind of coming around at the bottom is community health status assessment. You must conduct and you must know what the status of your community is, whether you're utilizing some of the data with some of the national surveys like the BRSFF or NHANES. Those two does a good job of providing overviews of health, the health indications and indicators of that community. And then finally, what are some of the forces that are at play when implementing your program or service? Okay, so to be more specific, there are seven principles: systems thinking, dialogue, shared vision, data, partnership, strategic thinking, a celebration of success. So one that they all kind of are intuitive and you might understand, and if you've read it in this area and know this literature, one thing that I will point out is the principle of systems thinking. Again, this is the idea of success is going to happen as a result of understanding that social, behavioral, and health concerns and issues are going to be impacted by a multi-level approach, right? It's not, you're going to have to know that understanding both the socio-ecological model, right? In the beginning of this lecture, we talked about the individual at the core, as well as the public policy making process at the outer core. So there is this multi-level foundations of social and behavioral health outcomes, and then also kind of the judicial, legislative, economic, and cultural forces that are at play when addressing a community problem. This is another framework that shows understanding the evaluation process. So this is kind of circular in nature. You see the steps that are on the outer circle, and then when you follow this circle and you follow this stepwise, you have to understand, well, what are the standards that are used? The standards of utility, feasibility, propriety, and accuracy, and that all these, as evaluations should serve as the practical information needs of a given audience. That's utility. And then, is it realistic? Is it prudent? Is it diplomatic? Is it frugal? Are the rights of individuals affected by the evaluation? So thinking about kind of the human rights issues when doing a program evaluation. And then very important is your data accurate? Right? So making sure these standards are fulfilled at each step will make sure that your evaluation process is going to be of high standard. So you're first going to engage the stakeholders, describing the program, focus on the design of the evaluation, gather evidence, justify conclusions, and then ensure use and share lessons learned. This Another model, they call it the logic model in evaluation. So I like this because it looks a little more simplified in terms of, okay, you have a planned work and you have intended results. And with your planned work, you're going to understand what resources and inputs that you need, the activities that needs to be done. And then the intended results are, well, the outputs or your outcomes, okay, the harms and the benefits that are coming out of this program. And then, of course, answering the question, what was its impact? Program evaluations. So this is where you can summarize your evaluation procedures. And there's two types of summary evaluation. We call it formative and summative. So I'm not going to get into great detail on this, but just so that you know, once you kind of summarize the evaluation process, think about it. Is it formative or summative, or is it a combination of both? Here are the acronyms that I talked to you and said that it would be available here at the very end. And then finally, the summary. I'm going to let you read that by yourself. Thank you again for your time, and good day, good evening, good afternoon, and good morning to all.